A new study shows just how heavily COVID-19 is impacting those with Alzheimer's and dementia in Colorado and across the country.
KRDO News Channel 13's Jen Moynihan is live in our studio to explain those findings. Jen.
Bart, Heather, the study, which looks at health records from nearly 62 million Americans, reinforces that need to protect those with the disease, but also highlights significant racial disparities.
Coloradans living with forms of dementia are already facing tough hurdles amid the pandemic.
During the pandemic, they found that nationwide, the death rate for people with Alzheimer's was almost 17% above expectations. And in Colorado, it was almost 21%.
That data now reinforced by new research showing they're twice as likely to get the virus.
That's been a pretty dramatic finding for us.
Jim Herlihy with the Colorado Alzheimer's Association says it's even greater for Black Americans, who are 3 times more likely.
It reinforces some of the other things we know about Alzheimer's, in that Black Americans are twice as likely as whites to develop Alzheimer's. And it's because of the very same reasons that this study points out.
Part of the problem, Herlihy says, is the lack of diverse data.
Getting a more diverse base of people involved in research would help really understand what the underlying causes are.
But it also points to an increased vulnerability for people with dementia.
Wearing a mask isn't natural to them, washing their hands, maintaining social distancing.
In addition to other more biological factors.
When people have dementia, their blood-brain barrier has been violated. The virus has gone through that. And once that has happened, it can make them more vulnerable to something like COVID.
Which makes finding a balance between protecting those most vulnerable and increased isolation even more challenging.
It's a puzzle, because how do you return their lifestyle to what we would consider normal with loved ones and yet protect them?
Now, that study does take into consideration other risk factors like old age, living in assisted care facilities, and pre-existing conditions. But researchers say more data is needed to better account for people living in communities with less access to health care or those who stay home. Reporting in studio, Jen Moynihan, KRDO News Channel 13.